Welcome to this explainer. Look, if you're a personal care assistant, or PCA, you already know the deal. Caring for folks with dementia is incredibly rewarding, but man, it comes with some totally unique, downright exhausting challenges. Today, we're zooming in on what is, hands down, one of the most stressful hurdles you're going to face in your career: sleep disturbances. This explainer is built specifically for you. Think of it as your ultimate PCA toolkit. We're going to break down exactly why these midnight disruptions happen, and way more importantly, hand you the practical strategies to handle them. The goal here is keeping your clients safe and, honestly, keeping your own sanity intact.
Okay, let's dive into our roadmap for today's session. We'll be covering the midnight struggle, understanding sleep disturbances, the power of response, strategies for better sleep, and navigating nighttime wakefulness. All right, Section 1, the midnight struggle, navigating the 2 a.m. chaos. So, picture this. Put yourself in the middle of a super high-stress yet literally everyday caregiving scenario. You're completely exhausted, the house is pitch black, and suddenly, you hear shuffling. You walk out in the hallway, and your client is wide awake, frantically trying to button a shirt or put on shoes. They look right at you and urgently say, "I need to get ready for work, I can't be late." You glance at the clock. It is 2 in the morning, and they haven't worked in 20 years. Your immediate, completely sleep-deprived instinct is probably to argue, right? You want to say, "What are you talking about? It's 2 a.m. Please just go back to sleep. I have to be up in 3 hours." But the second you say that, they get defensive. They might even flip it on you and start treating you like a kid, telling you to go back to bed so you aren't late for school. The tension just skyrockets. The harder you push logic, the more agitated they get. It's absolute chaos, and guess what? Nobody is going back to sleep anytime soon.
Let's move to Section 2, understanding sleep disturbances, the why behind the wakefulness.
To actually fix that 2 a.m. chaos, we first have to understand the clinical reality of what's happening inside the patient's brain. Sleep disturbance is wildly common in dementia. It's essentially a condition where the patient's internal clock completely flips upside down. They might sleep way too much during the morning hours, but when the actual nighttime rolls around, wide awake. They often wake up in the middle of the night entirely disoriented, genuinely believing it's the middle of the day. This is absolutely crucial for you as a PCA to internalize. This is not intentional stubbornness. Your client isn't trying to push your buttons. They are just experiencing a really profound disorientation.
And there are a ton of tangible factors that can trigger this disorientation. It's not just some unavoidable mystery of the disease. There are very specific physiological and environmental culprits. Things like excessive napping or a sheer lack of engaging daytime activities can completely wreck a patient's sleep-wake cycle. Not getting enough morning sunlight? That throws off their circadian rhythm entirely. Then you've got medication side effects or stimulants like caffeine, alcohol, and nicotine. And here's a really frequently overlooked trigger: unmanaged pain. Think about it. If they are hurting, they for sure aren't sleeping.
So, the crucial takeaway here is that these disturbances are way more than just a nuisance that keeps you from getting your beauty sleep. They are severe safety hazards. A disoriented patient roaming around a dark house at 2 a.m. is at a massive risk for falling. They're at risk for wandering right out the front door or getting into other unsupervised behaviors that could result in really serious injury. As a PCA, actively managing their sleep cycle is quite literally a matter of life and safety.
Which brings us to Section 3, the power of response, the golden rule of caregiving.
Okay, this is what I like to call the golden rule of caregiving. It requires us to take a deep breath and adopt a calm, methodical approach. Because at the end of the day, how you respond in that high-stress moment directly dictates the outcome of the entire night. Think back to that chaotic 2 a.m. scenario we just talked about. The frustrated response involves arguing about the time and invalidating their reality, telling them they haven't worked in 20 years. That just throws fuel on the fire and escalates their stress. But consider the alternative, the empathetic response. Instead of fighting their reality, what if you join it? You validate them. When they say they need to get ready for work, you gently intercept. You say, "You know what? You're right, but we have a little time. What would you say to a glass of warm milk first? One for you, one for me, and then we'll both get some more rest." You invite them to the kitchen, you ask them to help you warm it up. By validating their urgency and calmly redirecting them with a soothing activity, you instantly de-escalate the situation and pave a smooth road right back to bed.
Moving on to Section 4, strategies for better sleep, the PCA preventative toolkit.
Now, the absolute best way to handle a 2 a.m. wake-up is to prevent it from ever happening in the first place. And that prevention, it happens entirely during the day. Let's look at some core daily habits that will literally save your sanity later that night. On the proactive side, you want to get them into morning sunlight right away to set that biological clock. Encourage daytime exercise a few times a week. Basically, keep them busy. Whether that's going to an adult day facility or having friends and family come over, keeping them stimulated is the secret sauce. On the flip side, there are things you absolutely must avoid. You've got to cut out light from computers and bright screens at least 90 minutes before bed. And while daytime exercise is fantastic, actually scratch any vigorous physical activity a few hours before bedtime so they aren't all wired. And critically, skip the over-the-counter PM medications. Taking charge of these daytime habits is a massive, massive step in reducing nighttime stress for both of you.
Listen, if there is one single number you take away from this entire explainer, let it be this one: 30. 30 minutes is the absolute maximum amount of time a dementia patient should be napping during the day. If they absolutely positively must nap, you limit it to once a day, and you cap it at exactly 30 minutes. Any longer than that, and you are just borrowing trouble for the night shift.
You also need to optimize the physical bedroom environment. Try to maintain a super regular schedule for meals, bedtime, and waking up. Provide nightlights so the room is never totally pitch black. And here is a really wonderful pro tip. Fill the bedroom with familiar objects, like prominent family pictures. If your client does wake up in the dark, seeing those familiar, friendly faces immediately helps dial back that terrifying disorientation. And of course, like we mentioned earlier, make sure you're coordinating with medical professionals to ensure adequate pain management, so physical discomfort isn't what's waking them up.
Finally, Section 5, Navigating Nighttime Wakefulness, In-the-Moment Protocol.
We have to be real here and acknowledge that despite all your incredible preventative efforts during the day, wake-ups are still going to happen. It's just the nature of dementia. But when they do, here is your exact step-by-step protocol for the moment. Step 1. If your client wakes up and can't immediately get back to sleep, actively discourage them from just lying there staring at the ceiling. The bed should be psychologically associated only with sleep. Step 2. Encourage them to get up and move to a bedside chair. Physically relocating them is so essential for a mental reset. Step 3. Keep the lighting very, very dim and keep the room cool. Whatever you do, do not flip on the bright overhead lights. Step 4. Play some relaxing, soothing music. The goal here is to create a tranquil environment outside of the bed, wait until they start feeling drowsy again, and then gently guide them back under the covers.
So we've covered the underlying causes, the preventative daytime steps, and the in-the-moment nighttime protocols. But honestly, it all comes down to you. So I want to leave you with this question to really think about before your very next PCA shift. When the clock strikes 2 a.m. and that confusion sets in, how will your response shape their night? Will you fight their reality, or will you use your training and your empathy to guide them safely back to rest? The choice and the power to make a real difference is entirely in your hands.